Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the way in which I combine peptides, red light, and vagus nerve stimulator. So for myself, I have a 25-year history of Lyme and Bartonella, which is very well controlled, but when I have a big stressor like a move or a death in the family, I will relapse a little bit. But one of the symptoms that I have that is really irritating is I have inflammation of my esophagus, largely from Bartonella. And it has become so bad that, they had to put me on proton pump inhibitors, which I really don't want to be on. But if I don't, the acid just erodes my esophagus. So they thought I was going to have surgery, and I was like, no, I'm not doing surgery. I'll figure it out. So I started putting some things together. Red light, which I do for 2 10-minute strong red light laser for 10 minutes twice a day. I do injectable peptides at night. I do both BPC 157 to lower inflammation and TB 500 to support my immune system. And I use a vagus nerve stimulator. It's called TVNS. You can get it on, I believe it's vegas.net. And it's a game changer. You hook it onto your ear. It sends an electrical signal. It feels like a little tingling, a little mild irritation for 15 minutes. I do it twice a day. And, you can be doing other things. You can be reading, you can be on the computer, you can be watching television. You can do any of a number of things while you have it on. Clips right here. And that really helps re-regulate your vagus nerve, which is hugely important for regulating your autonomic nervous system. So lots of people with tick-borne illness, mycotoxin illness, COVID, long COVID, have autonomic nervous system dysfunction or dysregulation. It's common. And we often see autonomic nervous system dysfunction in the form of POTS, postural orthostatic tachycardia syndrome, and we see it in the triad of POTS, EDS, Ehlers-Danlos syndrome, and MCAS, mast cell activation syndrome. So you see that cohort of symptomatology. Oftentimes you see them together. So, anyways, the reason I'm doing this video is because I wanted to share with you a way that I put several different modalities: vagus nerve stimulator, injectable peptides, and red laser light. And it has really calmed my inflammation down. My inflammation used to be like a 21 out of 10. Now it's like a 5 out of 10. I can completely deal, and I didn't have to have surgery. So, some people want surgery, in which case then have surgery. I don't particularly like to be in the system at all. I don't like to go to hospitals. I don't like to have surgery. And so for myself, I had to find another way. So I hope that this information has helped you, just give you an idea of how you can work with your practitioner to put different modalities together to help your body heal from whatever it is that you're trying to combat. Okie doke. Take care. Have a wonderful day.